My name is Tony Parolisi, and I'm going to review the commercials for Xarelto. The commercials are similar in content. They have people that have an active lifestyle. They have such TV personalities as a race car driver, Brian Vicks, pro golfer Arnold Palmer, comedian Kevin Hicks. They focus on people who have AFib, which is an irregular heart problem not caused by a valve problem. And it's one particular commercial focuses on Jim, who is tied down to his monthly clinic trip to have his blood checked. But now that he's on Xarelto, he's free to move about, do what he wants to, but he was at great risk. The thing about Xarelto is that you're able to take it once a day. You can have it with your evening meal. It has no dietary restrictions. Jim can eat healthy. But it doesn't say what the comparison is between warfarin and Xarelto for people who take it, but you cannot stop taking it until you consult your physician. The commercial does highlight that you may have symptoms of bleeding, unusual bruising, tingling. You may be at higher risk for bleeding if you take Xarelto with aspirin products, NSAIDs, or blood thinners. But they stress that you need to talk to your doctor if you do have these symptoms. Xarelto can cause bleeding, which may be serious and rarely may lead to death. And it says that while you're taking Xarelto, it may take longer for the bleeding to stop. And it also goes on to tell you that you should tell your doctor before you have any kind of planned medical or dental procedures. And what they do say in the product insert is that the above that I mentioned earlier. The commercial does not cover that. You should tell your doctor about all the medicines you take, including prescription and non-prescription medications, vitamins, herbal medicines, may affect the way Xarelto works. The commercial just states that if you have a higher risk of bleeding with the NSAIDs, aspirin products, and blood thinners. It does not state what the dose is for the AFib. It doesn't, but their package insert says there's no regular dosage adjustments. Most people with AFib will stay with the same dose throughout their treatment. People with kidney problems, however, may have to have their dosage adjusted. Dosage may require blood tests throughout the treatment. There's doses for DVT and PE. You may have to take it twice a day for the first 21 days and then switch to 20 milligrams once a day. The dosages may be adjusted, and you may still have to have regular blood tests. There's dosages that they do not cover in the commercial regarding hip or knee replacement surgery. Following the surgery, it just says that most people will stay on the same dosages. And for people who have current AFib that are well managed on warfarin, there is limited information how Xarelto works in the warfarin compared to reducing the risk of stroke. In the commercial, they just said there's no information regarding the comparison of both of them and how it works for stroke. It also the package insert also warns against the spinal and epidural clots that occur with people that take blood thinners, especially like Xarelto, that there's risks involved. If I was going to try to talk to a patient regarding the pros and cons of taking Xarelto, I would explain to her that she's been on the warfarin and she's had no problems with her AFib, and that she may have other comorbidities that could not be equivalent to her lifestyle. It's nice taking one medication that you can probably get and not have to have the monthly blood tests, but you still have to watch your diet if you're a diabetic. I think the pharmaceutical companies play on people's experiences, and if they're afraid of needles, that's probably one option that they want to go with. And it's hard to judge by a commercial because every situation is different. I would just tell this patient that since she's had no problems with her warfarin and does not need to have her bloods checked more than once a month because she's been stable, the doses of Xarelto might have to be adjusted at various times during the treatment with a regular blood test anyway if her condition changes. It's possible that she may not need to change her dose of warfarin And Xarelto has too many risks involved. As I said before, I think the pharmaceutical advertisements take advantage of people because of the celebrity status. The commercials also discuss the patient should speak with their doctor, but the physician is the only one that really knows what the patient's condition is. Sometimes people look at the commercial and that this is the drug of choice that would be good for them, and they don't know the entire story. You can use this type of pharmaceutical advertisement to the patient's advantage to find out exactly what her choices are, what their lifestyle is, flexibility with their drug choices. I would ask her if there's any questions that maybe weren't posed in the commercial to begin with, if there's an underlying issue of a question she may need another answer to. There's got to be more to the story. And that's my review of Xarelto.